world. This is episode number 3 of the Investing is Hard podcast. Today's story has a little bit of everything: SPACs, roll ups, billionaires, boardroom drama, and bankruptcy. I'm talking about Cano Health. Now, before we get going, there's a YouTube link in the show notes that'll take you to a SumZero interview from a few years back. It makes a thoughtful bull case for Cano. I'd suggest watching it so you get a full perspective of the story. This episode is not a dunk on that interview. I didn't even know about it until after I put this episode together. But the point is to learn from the gap between that thesis and what ultimately happened. Shout out to a good friend of mine on Twitter, Karst Research. This idea comes from him. He owned this at one point and was willing to let me share his thought process and experience. That'll be later in the episode. But let's get started with what Cano Health is. Cano Health is basically a network of doctors' offices for old people. It was co-founded by Marlo Hernandez in Florida, focusing on underserved Latino markets. At its peak as a public company, they had about 141 centers across 9 states and Puerto Rico with over 4,000 employees. So, how did they make money? Most of Cano's patients were on Medicare Advantage, which is a private version of Medicare. So with regular Medicare, the government pays your medical bills directly. With Medicare Advantage, the government pays a private insurance company to cover you. That insurance company then pays groups like Cano Health a fixed amount per patient per month. That fixed fee per member per month setup is called capitation. Cano also had members with Medicaid and ACA coverage, but those are typically much lower fees per patient per month. That's why even though Medicare patients were only around half of the total member headcount, they were 90% of the revenue. Now, one important thing to understand with a capitation model is Cano takes the risk. Cano essentially gets a monthly budget to care for each patient. If that person stays healthy and out of the hospital, Cano makes money because they receive a monthly fee and don't have to spend it all on the patient. If the patient costs more than the monthly fee Cano is receiving, Cano eats the loss. That's why you'll hear about the medical cost ratio, or MCR, which is claims divided by revenue. And MCR over 100% means you're paying out more than you take in. There's also something called the Medicare Risk Adjustment, MRA. How it works is Medicare pays more money for members who are sicker and less money for healthier ones, which makes sense. So each member gets a risk score. That score has all the usual stuff: age, sex, diagnoses, chronic conditions, etc. In general, more conditions equals a higher score, which equals higher monthly payments for that member. So providers like Cano forecast revenue using expected risk scores, keyword expected. As time goes on and all the data is processed, actual scores come in. If the actual score is lower than expected, Medicare says we paid you too much, and the plan's revenue is revised down. That is called the true up. And that shortfall often flows through to provider groups that are paid via capitation. So, as an example, if you take a base rate of $1,000 per member per month, and you expect a risk score of 1.3, then you budget for $1,300. But if the actual score comes in at 1.15, then that is $1,150. That would be a $150 gap per patient per month. That may not sound like much, but multiply that by, say, 5,000 members over 6 months, you're talking about 4.5 million less revenue than you'd planned for. Now imagine a company like Cano Health, who had more than 300,000 members. Diagnoses not being documented or coded properly, a healthier member mix than expected, or rule changes in Medicare's risk model can all make scores come in light. But just remember, MRA is a how sick are these people adjustment. If the final answer is less sick than you thought, then Medicare pays you less, and the true up hits revenue, which crushes your margins. So in 2021, Cano Health went public via SPAC. If you don't know what SPAC is, it's basically a publicly traded pile of cash with a shelf life. A sponsor raises money and then has around 2 years to find an operating business to merge with. If the merger closes, the private company becomes publicly traded. The sponsor doesn't find an operating business, then the SPAC liquidates. So Cano Health merged with Jaws Acquisition Corp., which was a SPAC backed by billionaire investor Barry Sternlicht in 2021. The deal brought Cano Health public and gave them almost $1.5 billion cash to fund growth. So, right after going public, Cano goes shopping. They started trading June 4th, 2021, and just 10 days later, Cano announced a $600 million acquisition funded mostly with cash on hand. They also raised guidance for the rest of the year. And just 2 weeks after that, they announced another $300 million acquisition and borrowed $250 million through an unsecured debt facility. So immediately, classic roll up, buying clinics, buying members, expecting synergies. And by 2023, Cano Health had scale. For context, in 2017, they were only in 2 markets and had less than 14,000 members. But by the end of 2022, they had over 300,000 members across 9 states and Puerto Rico. But despite the scale and growth, the numbers weren't great. By spring 2023, Cano reported more than $2.5 billion in revenue, but more than $400 million in a net loss. Operating cash flow was negative. Adjusted EBITDA was negative. I mean, if adjusted EBITDA is negative, you know you're in trouble. The boardroom was also a mess. 3 directors resigned, including Sternlicht, who publicly ripped management for burning through over $1 billion in cash without improving core profitability, which resulted in the stock falling over 90% since its debut. He also mentioned the crippling debt and governance issues, especially around related party transactions, making it clear he no longer believed the co-founder CEO Marlo Hernandez should remain. Now, Cano countered publicly that the departing directors were focused solely on the short term, reaffirmed confidence in its fundamentals and long-term prospects. Of course, if that was going to be the case, they wouldn't have made it on the Investing is Hard podcast. So by Q2 2023, Cano's MCR was 103.5%, meaning Cano Health was paying out more in medical costs than they were bringing in revenue. That was caused by MRA coming in lower than expected. Again, MRA is how sick you expect people to be versus how sick they actually end up being. So because MRA was lower, Medicare paid less, which means Cano got less revenue than they expected. The other driver was medical costs running hot, including higher costs tied to health plan supplemental benefits like over-the-counter cards, which are prepaid allowances members can use for cold meds or whatever, and healthy food cards, which are allowances for certain healthy foods at certain stores. By June 2023, Cano had about $125 million of liquidity, but only $15 million was unrestricted cash plus a drawn revolver. Lenders amended a key loan and increased the cost to 16% paid in kind, meaning interest is added to principal instead of being paid in cash. And that's helpful for liquidity in the very short term, but snowballs the debt over time. Cano also formally launched a sale process as part of that amendment. So, just 2 years after implementing an aggressive roll-up strategy, they're now retreating and exiting several markets, including California, New Mexico, Illinois, later Puerto Rico, consolidating in Texas and Nevada, trying to focus on Florida where they started. I mean, it's a circle of life. They also cut 17% of their workforce and withdrew guidance for 2023. And in February 2024, Cano entered Chapter 11 bankruptcy, striking a deal with lenders to convert around $1 billion of secured debt into a mix of new debt and equity in a reorganized company. Lenders also provided $150 million of financing to fund operations through the process. Cano actually entered and exited bankruptcy in about 4.5 months. They filed in February, they were out by June with a new cap structure and focus on Florida. But for investors, the pre-bankruptcy shareholders got wiped out and lenders became the new owners. All right, so what went wrong? Were there any obvious red flags? I mean, the first thing was the aggressive expansion in debt. Within weeks of going public, Cano spent almost $1 billion, including $250 million unsecured debt draw on acquisitions. Second was the core Medicare cost turned against them at the worst time. In Q2 2023, MCR was over 100% and risk scores came in almost $60 million light. Third was the liquidity strain and expensive capital. By August 2023, Cano only had $15 million of unrestricted cash. Said there was substantial doubt about continuing as a going concern and amended debt at 16% while launching a formal sale process. And on the governance front, you had a high profile SPAC sponsor quit the board with quite a loud letter, citing crippling debt, poor forecasting, related party concerns. And let's actually talk about these related party transactions because there were a number of them. For example, Cano Health CEO Marlowe, his father was a general contractor who received $23 million from 2020 to 2022 for build outs, maintenance, and repairs. Marlowe's sister in law was employed at Cano as director of payroll, collecting $135,000 salary. Then there was the dental provider, Dental Excellence Partners, or DEP, formerly owned by Marlowe's wife. And that company was later sold to another company where she kept a minority stake. Cano paid around $9 million from 2020 to 2022 to Marlowe's wife's dental company to provide dental care for Cano members. Marlowe's brother was also a dentist at DEP. Then there was MedCloud Depot, which Cano Health COO owned 20% of. Cano paid around $5 million to license software for MedCloud from 2020 to 2022. There were leases with executives like Cano leased medical space tied to the CEO directly and via Humana clinic arrangements. Finally was MSP Recovery, now known as LifeWallet. This was a company that chases old claims that should have been paid by someone else. So Cano assigned some claims to MSP to pursue, and if MSP collected, Cano might get a cut of the cash. Barry Sternlicht specifically called this out because you're attaching collections work onto a clinic business with timing and counterparty risk and creating more accounting complexity at the worst time. And Sternlicht cites it as an example of poor governance. I want to briefly go through some notes and thoughts from my friend Car's research on Twitter now. He owned Cano stock, buying at various times in August 2023 before and after the company announced a going concern. So he'd followed and understood everything that was going on that we just covered. The stock's down, the situation looks bad. Karst understands the business, but he wasn't betting on a turnaround. He was betting that someone would come in and buy Cano. He was betting that there was residual value higher than what he was paying for the shares. And his thesis actually seemed validated a month later when Cano sold clinics in Texas and Nevada to Centerwell and announced broader exits. Centerwell was part of Humana, which is a giant Medicare Advantage plan. Cano had a lot of Humana members, and when Cano was restructuring, Humana's Centerwell was a key buyer. Humana also had the right of first refusal, meaning if Cano wanted to sell certain assets, they had to give Humana first dibs on matching A offers before selling to someone else. So the thesis looked good until it didn't. Carr's postmortem was first, he anchored to his first purchase price and added too quickly right after the stock fell from the going concern announcement. A going concern should be a signal to sell, not an invitation to buy more. He underestimated how much worse medical costs and financing would get. He was focused on what someone would pay instead of will someone pay now, because the other companies themselves were also experiencing high medical loss ratios. And lastly, he told me reading tea leaves works until it doesn't. I'll add on a few more lessons. First is if your core margin is susceptible to fluctuations like Cano's was with Medicare capitation, then a roll-up strategy and debt just magnifies the risk profile. Focus on profits first and growth second. Number two, keep an eye on complexity. Non-core deals, related party transactions, and governance issues all just add fuel to the fire. Three, be careful of false signals, like betting on someone acquiring the company, seeing it happen on a smaller scale, but all happening within the context of industry-wide headwinds. Just because someone has a first look with the right of first refusal doesn't guarantee a sale. So to wrap it up, Cano Health came to market at the height of the SPAC wave, wasted no time spending their new cash, and then hit a wall when Medicare risk revenue and medical costs moved against them. Governance and expensive debt exacerbated the issues, and shareholders lost everything. And it all happened fast. That's it for Cano Health. If you got a story you'd like to share, you can reach out to me on Twitter or email, both linked in the description. Otherwise, rate the show, tell a friend, and I'll see you next time.